infection specialist Dr. Bertha Serwa Ayi has called on the world leaders to act in concert to end the coronavirus pandemic by collaborating on a unified action plan now, not next month. This, she said, should have been done 6 weeks ago to avoid today's scenarios. Let's listen to her.
Most countries came to a point which I've been emphasizing probably since the end of January, that the one thing that is going to halt the spread of this outbreak or infection is the whole world coming to a halt, essentially lockdowns. Not a halt like over one day everybody should stop moving, but a strategic, planned halt. Maybe over 1 week, all the leaders decide, let's people stock up, get what you need, let's take care of the sick, everybody stay where you are. If we did that, I tell you, within 30 days, this outbreak will be over.
Right, we're fortunate to have Dr. Bertha Serwa Ayi on, to join us on this development. She's joining us on Skype from her base in the United Kingdom. Thank you very much, ma'am. And we're in the United States, I beg your pardon, Iowa. Thank you very much for joining us. So I want to understand what kind of cooperation you have been talking about, I mean, for world leaders to have this kind of cooperation to bring an end to coronavirus.
Well, it's essentially what happened yesterday after I put out the broadcast. The European Union, at the urging, I believe, of the French president, made a move similar to what I was discussing. The European Union, as of yesterday, has decided that there should be little entry into its 27 states from yesterday for the next 30 days. That is what I'm talking about. And this should have been done 6 weeks ago, because today, for example, the world is confirming 200,000 cases. And last week, just the beginning of last week, we were at 100,000. And I believe that's a lot more as testing goes on. We're all here watching and seeing when China went from 10,000 to 20,000 to now 80,000. And on March 16th, the cases outside of China was 86,000. It surpassed the cases in China. And on Friday, the WHO declared that Europe was now the new epicenter. Why did that have to happen? And unfortunately, the WHO keeps saying, you know, we can't restrict travel, just keep testing everybody. And we know exactly why Europe is the epicenter. The disease went from Asia or China to Europe. And unfortunately, Africa is now the fertile ground. February 14th, a Chinese traveler came into Egypt. February 28th, an Italian came into Nigeria. Those were the first few cases. Between February 28th and today, it's not been even 3 weeks. Africa is recording 282 cases. Just over the last 24 hours, you have Benin, Liberia. I mean, it's just Sierra Leone and a few countries. I'm shocked that we have over half of African countries now reporting cases. And we don't have to reinvent the wheel. We just have to see what's happening in China. Italy is reporting more than 3,500 cases every day. If we don't act now, Africa would become the new epicenter in the next 2 weeks. I'm not predicting doom, but 2 weeks ago, Europe had nothing. I mean, Italy woke up one day, 50 cases, 100, 2,000, 3,000. Today, Italy is at 27,000. People are being buried in the hundreds. 350 people dying every day. And Africa right now has the opportunity to make a difference. What I was calling for was a global action. I mean, we need somebody. They go and meet and do all these big G8 meetings between the presidents. Why can't they have one phone call and say from maybe March 25th to April 25th, whatever EU is doing, America is doing, because it's haphazard. Like EU has said 30 days. What it means is that April 17th, the ban will be lifted. So next week, if EU, I hope, decides, okay, we're also putting a 30-day ban, when Europe's ban is off on April 17th, African Union's ban will be coming up April 28th. In Asia, it's also haphazard. China fortunately still has a lockdown on movements in Wuhan City, but then it says, oh, you can come to Beijing, you can go to Guangdong. In the US, it's even worse. I mean, US was one of the first to put travel boundaries. You said China shouldn't come in February 2nd, and then later on it's added Europe. But within the US, every state is doing what it wants. New York governor is acting. Some states are wondering, oh, maybe I'll close schools. Currently, 850 million children are not in school. It's already happening. In the UK, the teachers are complaining. Everything is closed down except schools. What sense does that make? We're just allowing everybody to do everything. Meanwhile, I know they all know how to call each other. And what I'm asking for is we need a leader to emerge. In the US, for example, the governor of the New York State has done amazing. Governor Cuomo, he just took the bull by the horns, locked down a town called New Rochelle, called in the National Guard, and by the way, France is also calling 100,000 soldiers to enforce its people staying indoors. They are not going to allow people to come out. And then he started putting testing centers in New York all over. People can just drive through and test. Why? Because the government was being slow. For a nation of 300 million people, there were only 4,500 tests that had been done.
Right.
So in essence, that's what I'm calling for.
Dr. Ayi, thank you very much. We're grateful that we could have you, and keep safe, you and your family and all our lovely friends and family in the United States too, in this very trying moment. Thank you very much.